Which of the following laws allow a mentally stable patient to leave AMA against medical advice from a hospital? A. Common law. B. Precedent law. C. Civil law. D. State law. Answer is A. Common law. Explanation. Common law allows a mental stable patient to make their own healthcare decisions. If a patient who is mentally competent wants to leave the hospital AMA, then they have the right to do so. Next question. A nurse is assigning tasks to an LPN. Which task is appropriate? A. Teaching a newly diagnosed diabetic about insulin use. B. Administering 4-push morphine. C. Collecting vital signs from a stable post-op client. D. Conducting a mental health intake assessment. Answer is C. Collecting vital signs from a stable post-op client. Explanation. LPNs can collect vital signs but cannot perform initial assessments or complex teaching. Next question. You're the nurse caring for a patient who is newly diagnosed with CHF. You may ask the UAP to perform all of the tasks except A. Measure the patient's intake and output. B. Educate the family on the reason for strict Is and O's. C. Provide Foley care. D. Give the patient something to drink. Answer. B. Educate the family on the reason for strict Is and O's. Explanation. Unlicensed personnel cannot educate. Therefore, having a nurse aide to educate a family on a diagnosis of CHF is not permitted. Next question. Medical battery often occurs when a doctor or other healthcare provider denies you the chance to choose whether to get medical therapy. The act may involve touching or other objectionable behavior and is done with intention. Which of the following is an example of medical battery? A. Failure to diagnose. B. Failure to provide proper treatment. C. Performing a procedure without the consent of the patient. D. Misdiagnosis. Answer is C. Performing a procedure without the consent of the patient. Explanation. When someone hurts another person physically when they are in a medical environment, it is called medical battery. Battery is defined as touching with the purpose to cause hurt or offense. It is harmful if it causes harm of some kind. Performing an invasive procedure without a patient's consent is an example. Next question. Which client should the nurse see first? A. A patient with a scheduled discharge. B. A post-op patient with 300 milliliters output in the last 2 hours. C. A client requesting pain meds. D. A stable stroke patient needing help ambulating. Answer is B. A post-op patient with 300 milliliters output in the last 2 hours. Next question. What should the nurse do? A. Supervise the CNA the entire time. B. Reassess the CNA's competency after task completion. C. Ensure the CNA has training and the patient is stable. D. Do the task herself. Answer is C. Ensure the CNA has training and the patient is stable. Explanation. Delegation requires matching task, patient condition, and training. Next question. As it pertains to medical competence, nurses are required to deliver a level of care that avoids or minimizes risk. What is the term for this? A. Non-beneficence. B. Veracity. C. Non-maleficence. D. Beneficence. Answer is C. Non-maleficence. Explanation. According to the non-maleficence principle, it is wrong to cause harm to other people. Nurses are required to provide care in a way that does not cause harm to the patient. Next question. In the event that you are unable to speak for yourself, a healthcare proxy designates a trusted individual as your agent, proxy, or representative to communicate your intentions and make healthcare choices on your behalf. The power of attorney will be the healthcare proxy. Which of the following individuals would need a healthcare proxy? A. A married man who is on the ventilator but able to communicate. B. An 87-year-old with beginning stages of dementia. C. A 20-year-old who is in a coma following an MVA. D. A deaf and mute man recovering from a stroke. Answer is C. A 20-year-old who is in a coma following an MVA. Explanation. A 20-year-old in a coma is not able to make medical decisions for themselves. They would need a POA/healthcare proxy to make any decisions about their medical needs. Next question. Who can the RN assign to a new post-op client? A. Another RN. B. LPN, C. CNA, D. Unlicensed personnel. Answer is A. Another RN. Explanation. New post-op clients require assessment and RN level judgment. Next question. A nurse receives 4 clients. Who should be assessed first? A. CHF patient requesting PRN diuretic. B. Diabetic with blood sugar of 220. C. COPD patient with RR8. D. Client with chronic back pain. Answer is C. COPD patient with RR8. Explanation. Low respiratory rate is life-threatening. Next question. Which action by a nurse manager shows effective leadership? A. Doing all tasks personally. B. Ignoring staff conflict. C. Encouraging open communication. D. Avoiding feedback. Answer is C. Encouraging open communication. Explanation. Communication fosters trust and productivity. Next question. A nurse receives an inappropriate order. What is the best action? A. Follow the order. B. Ignore the order. C. Clarify with the provider. D. Tell the CNA to do it. Answer is C. Clarify with the provider. Explanation. Clarification ensures patient safety and legal protection. Next question. What is the name of the act that states that when a patient is admitted to a healthcare institution, the nurse has a legal obligation to explain and educate the patient about advanced directives? A. Patient Self-Determination Act of 1990. B. Healthcare Proxy Act of 1970. C. Power of Attorney Act of 1992. D. Legal Determination Act of 1975. Answer is A. Patient Self-Determination Act of 1990. Explanation. Compliance with the Patient Self-Determination Act, PSDA, of federal legislation is required. The aim of this law is to guarantee that patients' rights to informed consent and protection in healthcare choices are upheld. This means that all education should be provided to patients so that they may make an informed decision when it comes to their health. Next question. Which of the following ensures that patients receive appropriate care, patient independence and decision-making rights, patient respect, privacy, and access to a complaints mechanism? A. The Health Care Act of 2010. B. The Patient's Bill of Rights. C. The Health Insurance Portability and Accountability Act. D. The Patient's Civil Rights. Answer is B. The Patient's Bill of Rights. Explanation. The Patient's Bill of Rights ensures that the patient is entitled to appropriate care, that they can independently make their own health care decisions, that they are entitled to respect and privacy, and that they have someone/some entity to complain to when these Bill of Rights are not upheld. Each hospital should have the Bill of Rights in a place for patients to view freely. Next question. Which task can be delegated to the UAP? A. Assessing pain. B. Assisting with ambulation. C. Changing wound dressing. D. Educating patient on mobility. Answer is B. Assisting with ambulation. Explanation. UAPs can assist with ADLs, but not assessments or education. Next question. Which situation requires the charge nurse to intervene? A. CNA records output. B. LPN teaches insulin administration. C. RN starts for antibiotics. D. LPN gives oral medications. Answer is B. LPN teaches insulin administration. Explanation. Teaching requires RN level education and scope. Next question. Which patient needs the RN first? A. Post-op patient with mild nausea. B. Client with DVT on heparin with hematuria. C. Diabetic patient with glucose of 150. D. Dementia patient refusing care. Answer is B. Client with DVT on heparin with hematuria. Explanation. Hematuria on heparin may indicate bleeding risk. Next question. A client refuses medication. The nurse should first A. Insist they take it. B. Educate about the medication. C. Document and discard the medication. D. Call the provider. Answer is B. Educate about the medication. Explanation. Educate first, then respect autonomy. Next question. A nurse prioritizes which patient first? A. Fever of 100 degrees Fahrenheit. B. Pain score of 9. C. Oxygen sat 89%. D. Dressing needs change. Answer is C. Oxygen sat 89%. Explanation. Hypoxia is life-threatening. Next question. What is the priority in a disaster triage? A. Minor wounds. B. Clients with low survival chances. C. Clients with severe but treatable injuries. D. Clients asking for pain relief. Answer is C. Clients with severe but treatable injuries. Explanation. Triage focuses on maximizing survival. Next question. It is imperative that the nurse advocate for the patient. Which of the following best describes a nurse advocating for a patient? A. Giving an opinion on different medical treatments so that the patient can pick the best option. B. Telling a patient who the best surgeon in the hospital is to perform his or her surgery. C. Explaining test results in depth after a physician has given the initial results. D. Telling the patient that it is best for her to take her medications so that she does not become more ill. Answer is C. Explaining test results in depth after a physician has given the initial results. Explanation. Nurses act as advocates for patients in many ways. One way is to explain anything that the patient does not understand. If a physician explains something to a patient and they do not understand it, it is your job as the nurse to ensure that they do. This is an example of advocating for your patient. Next question. What is the term for something that often entails giving responsibility for the outcome while assigning non-licensed assistance people to execute activities or duties linked to patient care? A. Delegation. B. Autonomy. C. Beneficence. D. Validation. Answer is A. Delegation. Explanation. Delegation often entails giving responsibility for the outcome while assigning non-licensed assistance people to execute activities or duties linked to patient care. Making nursing decisions is a responsibility that can only be assigned by a qualified nurse. Next question. What is the term for a collaborative approach that supports suggested treatment plans to ensure that patients with disabilities, illnesses, or injuries receive the proper medical care? A. Delegation. B. Case management. C. Care plan. D. Clinical approach. Answer is B. Case management. Explanation. A collaborative process of assessment, planning, facilitation, care coordination, evaluation, and advocacy for alternatives and services to address an individual's and family's complete health needs to encourage high-quality, cost-effective results through communication and the use of existing resources. Next question. A confused patient wants to leave AMA. The nurse should A. Call security. B. Allow the patient to leave. C. Assess decision-making capacity. D. Restrain the patient. Answer is C. Assess decision-making capacity. Explanation. Capacity must be evaluated before action. Next question. A nurse makes a med error. Best action? A. Hide it. B. Report and monitor the patient. C. Blame the pharmacy. D. Ask CNA to watch the client. Answer is B. Report and monitor the patient. Explanation. Accountability ensures safety and ethical practice. Next question. Which demonstrates autonomy? A. Doctor orders tests. B. Patient declines treatment. C. Nurse gives meds. D. Family makes all decisions. Answer. B. Patient declines treatment. Explanation. Autonomy is the right to make personal choices. Next question. A nurse notices a pure smelling of alcohol. What should the nurse do? A. Ignore it. B. Report to the supervisor. C. Ask them to go home. D. Notify the patient. Answer. B. Report to the supervisor. Explanation. Reporting protects patients and upholds professional standards. Next question. You're a nurse working in the intensive care unit. A person calls and states that he is your patient's pastor and wants to update the prayer log about how the patient is doing. The pastor is not on the patient's chart of people to share health information with. What is the correct action for you to take? A. Give the pastor an update since clergy and members of the church are a necessary part of the healthcare team. B. Tell the pastor to call the patient's room. C. Explain to the pastor that you are not allowed to give the information requested because he is not on the patient's chart to give out information to. D. Tell the pastor to call the family and request the information. Answer is C. Explain to the pastor that you are not allowed to give the information requested because he is not on the patient's chart to give out information to. Explanation. It is the nurse's responsibility to kindly explain that to the pastor and not give out the PHI. Next question. What is the name of the federal legislation that mandated the development of national standards to prevent the disclosure of sensitive patient health information without the patient's knowledge or consent? A. The Self-Delegation Act of 2000. B. The Health Insurance Portability and Accountability Act of 1996. C. The Civil Law Act of 1979. D. The Health Insurance Portability and Accessibility Act of 1996. Answer is B. The Health Insurance Portability and Accountability Act of 1996. Explanation. A federal legislation known as the Health Insurance Portability and Accountability Act of 1996, YEPA, mandated the development of national standards to prevent the disclosure of sensitive patient health information without the patient's knowledge or consent. It was signed by Bill Clinton on August 21, 1996. Next question. You're the case management nurse trying to receive placement into a skilled nursing facility for a patient. You have to ensure that you maintain HIPAA during this process. Which of the following information is not okay to provide the SNF? A. The patient's name, DOB, length of stay. B. The patient's insurance information. C. The bill statement from your facility hospital. D. The patient's social security number. Answer is C. The bill statement from your facility hospital. Explanation. Only information that is used to provide care to the patient can be given to a facility that you are transferring the patient to. A billing statement from your facility does not aid in the care of the patient. Next question. In ethical dilemmas, what should the nurse do first? A. Follow hospital policy. B. Consult with ethics committee. C. Identify the dilemma. D. Notify family. Answer is C. Identify the dilemma. Explanation. Clearly defining the dilemma is the first step in resolution. Next question. A nurse delegates feeding to UAP. UAP reports choking. RN should A. Document the incident. B. Call the provider. C. Assess the client immediately. D. Instruct UAP to give water. Answer is C. Assess the client immediately. Explanation. The RN must assess and intervene immediately. Next question. Which nurse action violates patient confidentiality? A. Discussing in a private room. B. Sharing details with authorized staff. C. Talking loudly in a hallway. D. Using initials in a report. Answer, C. Talking loudly in a hallway. Explanation. HIPAA violations include public disclosures. Thank you for watching our channel. If you enjoyed the video, don't forget to like, comment, share, and subscribe for more great content. Your support means the world to us.